You're watching TVC Breakfast. Now, Nigeria is taking steps to ensure that the deadly Ebola virus does not make its way into the country through a carrier.
And for this reason, the Nigerian Civil Aviation Authority has issued an alert warning airlines operating regional and international flights to exercise a high level of vigilance.
Now, this followed the World Health Organization declaration of Ebola outbreak as a public health emergency of international concern. The NCAA directed airlines pilots in command to report to air traffic control any suspected case of communicable disease on board their flight in line with civil aviation regulations and contact port health services for clearance before importing human remains into the country. The NCAA believes strict compliance with the directive will prevent the incursion of Ebola or any communicable disease into the country. I have with me right now in the studio Dr. Joseph Onigbinde, infectious disease specialist and former medical director, Rofeka Medical and Dental Hospital. It's nice to see you, Doctor.
Good morning.
Good morning.
Good morning.
Right.
Nice to see you.
Make us understand. The Ebola in right now in Congo has been declared, you know, of international health concern. What kind of concern, for instance, like Nigeria, who has had it before and was able to overcome it, what kind of concern should we now have as a country?
I mean, talking of Nigeria, oh yes, we should be concerned for the fact that a lot of our people are very mobile.
Yeah.
Somebody could just, I mean, many of our people, they have businesses in Congo. So if we travel to that area, you don't know what can happen. I pray that nobody will come and import it again to Nigeria. We were very lucky. The time we visited 5 years ago. This time around, I don't know whether we'll be that lucky. Because we are lucky because at that time, doctors were on strike. So we didn't have a wide exposure. So I think we should be concerned about.
All right. I see you have an appliance or equipment in front of you right now. Can you make us understand what it is and what it's used for?
This is non-contact thermometer.
Okay.
Or this is
it's like a gun. It has a trigger.
Yes, I said like a gun. I'm not here to shoot you anyway. I'm just here with it's just $10,000.
Oh!
I'll give it to you. Yeah, give it $10,000.
I'll wire it to your account immediately. That's interesting. So what is it used for and how does it work?
You know, this is a non-contact thermometer. Okay. A regular thermometer, you bring it out and put it on that patient's armpit or on the tongue. Okay. But this one, it doesn't have to contact the patient to see the reading here automatically. All right. So this is the type you use for infectious disease such as. So
you don't have contact. You don't come in contact with the person directly.
Actually, when you suspect somebody to be having some disease like Ebola, you should actually have 1 meter or 2 meters gap.
Can this capture about 1 meter?
No, just as you are sitting, I can do like this. Okay. To capture, you know, it is
okay.
It is battery operated, so it will. It's automated.
But the point is it meant to capture only the temperature, or it's meant to decipher between Ebola or non-Ebola?
No. It cannot decipher between. It's just the temperature. Okay. You see, one of the problems you have when you have a very infectious disease, you want to avoid contact with the patient. So this will help you to avoid contact because Ebola is so dangerous that if you just touch the skin ordinarily, you will catch it and then that will be terrible. So you have to avoid that with this type of.
So where can this appliance be used?
Oh, in the hospital.
Okay.
It can be in the hospital, in schools, everywhere. Anybody who has anyone who has temperature, fever. This is how you want to monitor that. Okay. So actually, this was supplied to Ondo State. Ondo State. Okay. I trained them in the prevention of Ebola in 2014. So
that was when Ebola came to Nigeria.
Yes, to visit Nigeria.
Now, before I let you go, in the case where maybe at the airports or anywhere that this appliance detects any unusual temperature, what next?
Oh, you have to screen the person.
Okay.
You have to screen the person. Actually, this type of something is also used at the airport, and but should be used at the borders. So anybody that has very high temperature, you have to, I mean, further investigate whether it is just malaria or something else.
Looking back at 2014, I know you were also a leading voice, back then, working to curb Ebola spread. But the spread of Ebola, now, 5 years after that period, has the nation learned anything?
Well, thank you very much. It's sad to know that we have barely learned nothing, absolutely nothing from that time. I'm afraid that even if we have another case of Ebola now, we might not even be able to cope, unlike what we did 5 years ago.
So where are still the gray areas that haven't been tackled?
Oh no, we've not been doing, all the structures are not in place. We've not been building our structures. We've almost structureless. I went to this hospital, hospital IDH, that's at Yaba, the other day. What the structures we had there 40 years ago are still there, dilapidated. And
it's good you mentioned IDH because yes. IDH also hosted
some
of the Ebola victims yes. and even medical practitioners who also paid the supreme price.
Yeah, actually that's the main center of where the structure we had at that time was just the one donated for polio by Belinda and Gates Foundation. Okay, not that we had a structure actually in place for Ebola, so we just converted it. But after that, everybody just went to sleep. So nothing has been done. As far as Nigeria is concerned, we are barely doing anything about health in this country.
And now you have this instrument with you. Tell us how it works, because I've seen this, at least I know some clinics in Lagos, make use of this, but how much of a breakthrough is this?
No, this is non-contact thermometer. It affords you the opportunity to pick up the temperature of your client without touching the clients. In places where you suspect that this fever is may not just be malaria only, it's not fair for you to be touching the patient's hand, so you just use this, and then
it beeps.
Yes.
And I'm fine.
Yeah, very fine.
Oh, I see.
Very fine. I can leave you with this. Just give me $10 million.
It's a matter of cash.
Yes.
But how many of these things do we have in the country now? Are you advocating that more of this should be in the system?
Absolutely, absolutely. I think every clinic, not even just clinic, even anywhere you have human beings coming to work, schools and so on, you should have this. Because instead of having this normal thermometer that you have to touch somebody, you can use this. This is very safe. This is what you should actually be using to avoid the opportunity of just contacting.
So it goes beyond Ebola now. Yes. Anything that has to do with scares or fever, I see. Talking about, you mentioned schools a while ago, yes. And I remember that back then, during the Ebola scare of 2014, schools had to, embark on this hand washing because it was basic that alone could save lives. Yes. How many of those health conscious habits do we even still have
Nothing.
now?
Barely a month after Ebola was, Nigeria was declared free of Ebola. Everything just went back to status quo and say, nobody's doing hand washing again, and that is very sad. That's very sad. We should be doing it. We should don't wait until we are visited again before you now begin to do fire brigade approach. And Nigeria is noted for that fire brigade approach.
Right, but then what is it about Ebola? Some have said that it used to be a rare disease, but now we see how it's ravaging neighboring countries, and the NCAA, that's the aviation agency here in Nigeria, is also bracing itself, for possible incursion. What are we dealing with?
Well, Ebola has been with us for long. It was first diagnosed, it was first described in 1976 by, interestingly, the man that I worked with, Peter Piot, first of all described Ebola in Congo, Kinshasa, Kinshasa, Zaire. It's a disease of the tropical rainforest, and it's usually the normal host are all these fruit bats, so fruit bats and monkeys. So it's actually a disease of animals, but it can also be transmitted to humans. And if you are not transmitted to a human being can also transmit to another human being through body fluids.
Absolutely.
So it's always been with us for quite some time. But I think because it's limited more or less to Africa, to rainforest, that's why people are not worried about it.
So it's never really gone?
No, it's never really gone.
So we are in a civilized world now, or so we like to assume. So some things are basic. You just all talked about, hand washing is becoming non-existent. Are you also advocating, like it was advocated then, hand sanitizers be brought back? How much good did that give us?
Oh, that is good. That is good. Hand sanitizers, hand washing, these are good habits that we should actually be doing. And even women in the kitchen, we must also prepare our meals with caution. So there was a time we were saying that don't be buying animals. What do you call them?
The bushmeat.
Bushmeat. There's nothing wrong with bushmeat. The problem is, how do you prepare bushmeat? If you wear gloves before you prepare your bushmeat, you are safe, because this virus itself cannot survive above certain temperature. But what if
I don't have a cut on my hand and I'm still washing the bushmeat? I'm still
no.
at
yes,
risk?
You don't have to have cut
okay.
Before you can catch Ebola. You don't need to have cut. Once you touch, and you have that habit in Africa, especially when somebody just died, you want to say, give parting gift or parting greetings, say, oh, bye-bye, please greet my grandfather, and you touch.
So gloves are a way to go. What about masks?
Well, that is when you are very sure.
Okay.
But if you can afford it, there's nothing bad in wearing a mask. But where you are sure you are dealing with Ebola, you must put on what we call PPE, personal protective equipment. That's gowns.
Dr. Joseph Onigbinde, to think that all these chips are actually life-saving. Thank you very much for sharing your medical insights in curbing Ebola.
Thank you.